Canada doesn't just lack doctors, it squanders the ones it has. Mountains of paperwork and pointless admin chew up tens of millions of physician hours every year, time that could erase the so-called shortage and slash wait lists if freed for patient care. Recruiting more doctors helps, but the fastest cure for our sick system is cutting the bureaucracy that strangles the ones already here. The Canadian Medical Association found that unnecessary non-patient work consumes millions of hours annually. That's the equivalent of 50.5 million patient visits, enough to give every Canadian at least one appointment and likely erase the physician shortage. Meanwhile, the Canadian Institute for Health Information estimates more than 6 million Canadians don't even have a family doctor. That's roughly 1 in 6 of us. And it's not just patients who feel the shortage, doctors themselves are paying the price. Endless forms don't just waste time, they drive doctors out of the profession. Burned out and frustrated, many cut their hours or leave entirely. And the foreign doctors that health authorities are trying to recruit? They might think twice once they discover how much time Canadian physicians spend on paperwork that adds nothing to patient care. But freeing doctors from forms isn't as simple as shredding them. Someone has to build systems that reduce rather than add to the workload. And that's where things get tricky. Trimming red tape usually means more information technology, IT, and big software projects have a well-earned reputation for spiraling in cost. Bent Flivbjerg, the global guru of project disasters, and his colleagues examined more than 5,000 IT projects in a 2022 study. They found outcomes didn't follow a neat bell curve, but a power law distribution. This means costs don't just rise steadily, they explode in a fat tail of nasty surprises as variables multiply. Oxford University and McKinsey offered equally bleak news. Their joint study concluded, on average, large IT projects run 45% over budget and 7% over time, while delivering 56% less value than predicted. If that sounds familiar, it should. Canada's Phoenix federal payroll fiasco, the payroll software introduced by Ottawa that left tens of thousands of federal workers underpaid or unpaid, is a cautionary tale etched into the national memory. The lesson isn't to avoid technology, but to get it right. Canada can't sidestep the digital route. The question is whether we adapt what others have built or design our own. One option is borrowing from the US or UK, where electronic health record systems, the digital patient files used by doctors and hospitals, are already in place. Both countries have had headaches with their systems, thanks to legal and regulatory differences. But there are signs of progress. The UK is experimenting with artificial intelligence to lighten the administrative load, and a joint UK-US study gives a glimpse of what's possible. AI technologies such as robotic process automation, RPA, predictive analytics, and natural language processing are transforming healthcare administration. RPA and AI-driven software applications are revolutionizing healthcare administration by automating routine tasks such as appointment scheduling, billing, and documentation. By handling repetitive rule-based tasks with speed and accuracy, these technologies minimize errors, reduce administrative burden, and enhance overall operational efficiency. For patients, that could mean fewer missed referrals, faster follow-up calls, and less time waiting for paperwork to clear before treatment. Still, even the best tools come with limits. Systems differ, and customization will drive up costs. But medicine is medicine, and AI tools can bridge more gaps than you might think. Run the math. If each freed patient visit is worth just $20, a conservative figure for the value of a basic appointment, the payoff could hit $1 billion in a single year. Updating costs would continue, but that's still cheap compared to the human and financial toll of endless waitlists. Cost sharing between provinces, Ottawa, municipalities, and even doctors themselves could spread the risk. Competitive bidding, with honest budgets and realistic timelines, is non-negotiable if we want to dodge another Phoenix-sized fiasco. The alternative of clinging to our current dysfunctional patchwork of physician information systems isn't really an option. It means more frustrated doctors walking away, fewer new ones coming in, and Canadians left to languish on wait lists that grow ever longer.